Good afternoon, everybody. This is Rob Hollis. I'm the program lead at Nolex, and pleased you can join us for this next webinar in the IPC webinar series on the subject of pertinent public health subject, in fact, of damp, dust, moulds and health. We are honoured to be joined by Dr. Rena Richardson, and when Rena joins us now, Rena, hi there. Could you give the people who've joined us a little on your background?
Sure, yes. So I'm an academic clinician, so work both for University of Manchester and the Manchester University NHS Foundation Trust. And as a university person, obviously do research in the area of fungal infection, but my NHS role is to be the head of service for the mycology reference lab. That includes our environmental mold surveillance service that we work together with the hospital infection prevention and control team in hospital settings and then outside for other things. So that's probably a brief summary what I do and why I'm talking to you today.
Okay, thank you very much. And just to remind everybody, we'll take your questions in the chat as we go along and endeavour to put as many of those to Rena as we can towards the end of the session. So Rena, I'll hand back over to you, and thank you very much.
Thank you, and I'll do my best again to share my slides. I presume they are coming up. Is that okay? Everybody sees that?
Yes, that looks fine, Rena.
Excellent. Okay, so that summarizes my background and the topic of today. And always, yes, important to disclose what you've been up to. So I'm a busy girl, being both involved with new antifungal clinical trials and then education lectures, just like today. So the topic, before we go any further, we have to first think what we are really talking about here. So we're talking about mainly about molds, and just to know that there are over 100,000 species of molds globally, and how we look at them, how we categorize them. Firstly, yeah, of course, that this sort of laboratory approach to it is to look at the color and the texture and the metabolites they produce, how they can be identified in the laboratory based on those features. But sort of from practical point of view, it's also important how you interpret certain findings. For example, if you grow a mold in environmental sampling, what does it mean? So we have to understand that it reflects the environment where it's been identified from. So some molds prefer very wet environments, others are happy with drier environments, and then others are very much vegans, want to only live on plants, and plant debris are their role is to basically compost and decay plant based products, whilst others are more adjusted also to cause human or animal disease. And so one of the sort of classifications is that are they plant pathogens or are they animal pathogens or potentially human pathogens? So that's one way of looking at it. So I mentioned already the impacts of growth requirements. So what do molds need to thrive? So really, it's the combination of these three things. They need nutrients that suit them. They want their favorite nutrients. Not every one of them grows on same media or same environment. Moisture is radically important, and there has to be enough moisture as per the requirements of that species. And warmth, of course, we all like warmth, and that helps things. And that combination is where molds thrive. The flip side of this is that if you remove any of these three, they will not thrive. And because we don't like to live in cold houses, or sometimes it's very difficult to get rid of organic materials in buildings, you do have to have wooden floors or structures, then the key factor we can most easily modify is moisture. But yeah, closer look at nutrients. As said, most of the molds globally are plant pathogens, vegans who cause trouble or benefit us in the form of compost. But then there are others that can contaminate food. These are gracious molds, mostly here shown, but some of them are also used in food manufacturing, right, like this blue cheese on the top, and that's Penicillium roquefortii, probably. So many of the Penicillium species are used in preserving food mainly. So their toxins they produce are toxic to bacteria. Themselves, they are safe for us to eat, and they keep potentially dangerous bacteria away from that cheese. So we use them in many ways. And corn is equally a mold product that we can use as a meat substitute in cooking. Nutrients, some molds, not all, some are happy to degrade and grow on wood. Others are happy to grow on wallpaper, paper, but they are specific requirements. Not everything, not every mold does the same thing. Finally, the sort of practical nutrient that is important when we talk about mold prevention is to consider dust. So dust, firstly, it's sort of ground up combination of all of the nutrients I listed before. We bring in some organic matter from outdoors in our shoes. There is plant sort of powder, plant powder in dust. There is human epithelial cells. There is all sorts, and all that is nutrients to molds. But in addition to that, dust is hygroscopic. It means it itself attracts moisture, so it's a perfect growth environment for molds. So therefore, the backbone of any mold renovation or cleanup is to get rid of dust. So moisture, the third component, that is where we're talking now about indoor mold, really focusing on that and thinking, where does moisture come from? So it doesn't take much. So we breathe, our exhaled breath has moisture. Obviously cooking, and we have all sorts of other things in houses, like plants and things, or vase of flowers and so forth. All that evaporation is a source of moisture. But obviously the big ones are bath, showering, the steam coming from there, laundry, drying laundry indoors is basically an absolute no-no, other than in a condensing dryer or ventilated dryer. All that moisture is a potential risk, and it is extremely important to get rid of it, ventilate, and so forth. But in addition to what we as humans and our life in the house creates, there is always some moisture seeping through from under the building, or maybe your downstairs neighbors, as well as there's a risk of roof leakage and such. But also the other thing is that when you add warmth to that, there will be steam coming out of that building, and it will be condensing on that colder surface of the roof, and then that creates more moisture dripping into the living space. So moisture and warmth, and then your dust there, that is your perfect environment. So looking at then the health impacts, what is the spectrum of fungal diseases really? What can they cause? So there are 1.1 or more than billion cases per year globally of fungal diseases. But to put things into perspective, most of those are superficial. What we are talking about is toenail infections, athlete's foot, and ringworm and such. So there is about 17 million cases of allergic fungal disease or allergic mold disease, which is significant number itself, and it's the biggest health impact molds can have on health. There is also a small number of invasive deep aspergillus infections, invasive mold infections globally, that is mainly seen in very immunocompromised and otherwise unwell patients. So really, who is at risk for what type of mold disease, invasive or allergic, the two sort of ends of the spectrum, depends on their immune system and level of exposure. I'll expand that in a minute. But before we go any further, there is a topic we need to cover as well. So we often hear about mycotoxins, and just to clarify what they are and how they fit into the picture. As said already, broadly speaking, the main health effects molds have are related either to infection or the allergy aspects of it. So you have to have viable molds to cause infection, or you can have viable molds or mold proteins, some ground up dust having mold particles in them to cause allergy. Now, all environmental molds produce what we call low molecular weights, soluble and volatile compounds, or low volatile compounds, VOCs, that can be toxic to plants, insects, fungi, other fungi, or mammals, or like humans. So this is what we call the chemical warfare, and this is an example of what I said about the blue cheese. So this is what they do, and that's how penicillin was originally found, as you probably all know. Now, when we really talk about mycotoxin, we talk about only the soluble metabolic products that molds produce. So that is when crops or food is contaminated by these soluble toxins, and then we call them mycotoxins, and they can be harmful for humans or animals or when ingested. But it's really important to sort of keep again perspective to this, is that when these agriculturally important molds or otherwise the environmental molds grow on building materials, like they occasionally do, they don't in general produce mycotoxins. So there is no need for them to carry on that chemical warfare, because that tree does not fight back. So that they have won already. So there is far less production of mycotoxin on building materials compared to what happens in the nature. Now, obviously, active mold growth in any space releases volatile metabolites that we can smell. We can tell that there is maybe mold issue in the building, but that does not equal to mycotoxin, but even though they are not mycotoxins, or they are not toxic as such, they can be irritating and irritants. So that is the sort of, just to get the terminology right here in our heads. So going back to the spectrum of infection versus invasive disease, and I said that it all depends, the outcome depends on the immune system of the patient. Now, this is a so-called Casadevall curve, with the x-axis reflecting the level of immune responses the person has on the very much left, you have very immunocompromised persons, barely any immunity. In the middle there, you have a normal person with normal immune responses. And on the right-hand side, you have a very sort of hyperactive, allergic, asthmatic kind of a person, sort of overreactive immune system. The y-axis here reflects the amount of damage, the presence of fungi causing that person. And if you're in the middle there, we all inhale mold spores every day. They come and go, no damage, transient colonization, and that's it. But the weaker your immune system you have, the further left you go on this curve, on this graph, the curve starts to go up, the more damage you start seeing, and at some point you cross the damage threshold. And then at some point you start seeing invasion of fungal cells into tissues, and that is your invasive disease. Now, going to the other side, we often think that the stronger is the better, but that is not the case, because the immune system itself starts to turn against the host. So if you are overreacting to the presence of the fungi, you stronger and stronger your immune system is. The curve goes up again, and there's again more damage, and which can lead to even death via the sort of exuberant inflammation. To make this make sense, so you're in the middle, we talk about colonization, superficial infections. On the left, we invasive systemic infections, and on the right, it's your hypersensitivity, asthma, and allergies. So that is the spectrum of things. Now, looking at the species level, what are the most common causes of invasive disease? So for invasive diseases, mainly Aspergillus fumigatus in Central Northern Europe, slightly different when you go to Middle East and south from there. Fusarium definitely is one of the important molds, and then some mucorrheiceous molds are able to do this. We talk about Rhizopus and Muco and Lichtemia species. There is the other spectrum of causes, so the fungal species causing fungal asthma and allergy. Aspergillus is on both lists, but then there are others like Alternaria, Cladosporium, and Penicillium. So the penicillium, which I said was wonderful food preservant, and you know your blue cheese is safe to eat, but you can become sensitized to it, and you can develop allergy to it. Now, why aren't the same species both causes of invasive disease and allergy and asthma? The limiting factor really there is the thermotolerance, which is lack of thermotolerance of Cladosporium and Alternaria species, which means that they can't grow in human body temperature. They are environmental molds. They like the sort of 20-25 degrees environment, but when we inhale them, we get the spores into our lungs and airways. They can't do anything. They die away. And that way, the thermotolerance of Aspergillus and Fusarium and some of these voracious molds makes them the more pathogenic in that sense. Now, focusing a little bit on the nutrients for a minute. So we talk about the Green Book here. It's the American Institute for Healthcare associated infections or similar, sorry, I can't remember what the AHI is for. Anyway, they have an excellent book on indoor mold and impact on health. And the summary of that is that basically that all molds that are associated with damp buildings are preferably environmental. So they are not molds that are primarily human pathogens. That is different from example from the species of filamentous molds that cause your athlete's foot. They are preferably human pathogens, but these are preferably environmental. They primarily want to grow in the environment on plants and debris. And there are hundreds of species of fungi that are known to be part of the biodeterioration of building materials, and what is in those building materials finally tells what grows where, if there is enough moisture. And as said already, they're not all the same. Some are pickier than others, and other environments suit them better. I've just taken a few screenshots from the book just to reflect that how some things are different. So if we sort of tick the box for a green color is for allergic disease and red color is for invasive disease. So looking at, this is now insulation samples, insulation materials, we see a lot of various environmental modes that can grow there, sort of less pathogenic Aspergillus species, Penicillium species, and Cladosporium. So those allergy species, whereas Aspergillus fumigatus or flavus, which are the invasive disease fungi, are quite infrequent. So it's rare really to see them. They are primarily plant pathogens. They would prefer to grow on leaves and grass. Compare that to gypsum wallboard, again, making this a bit bigger for you so you can see similar sort of slightly different species now in the common and frequent categories, but infrequent, again, your fumigatus and flavus. So very similar in that sense. Looking at wood, wooden building materials, wood itself, making that a bit bigger for you. Again, allergic molds common can do that, but actually Aspergillus species are rare. They rarely grow on these, or it's not their primary preferred environment. Textile samples, they're again similar picture of more allergens potentially living on them, on your carpets and your other textiles in the house, but there is a difference. So actually, what we worry about is the Aspergillus, and Aspergillus the most important because it causes both allergic and invasive disease. It's not that common in building environments. There are other papers lifting them, sort of different materials, listing them, but interesting also that concrete, where you think that why would anything grow on concrete? Surely they're not chewing away the cement or the sand. But there is always concrete surface is always dusty. It's impossible to get it dust free, and dust supports the growth of Aspergillus and muco and all of these. So we shouldn't have bare, untreated concrete surfaces anywhere in hospital environment. And again, paint and wallpaper, different. You just go through these papers or the books and think where, but the summary of all this is that they are all different, and it's rare to see Aspergillus in indoor environment. Already said about the moisture requirements, that they vary between them, and that impacts also what materials they grow on, partially because other materials can be sort of more wet than others. Wallpaper compared to gypsum board. Gypsum board doesn't really get wet, even though it's soaking wet. It's relative humidity or water content is still relatively low. There is no free water for fungi to use. So what grows on what is partially dependent on the materials as well. Just a reminder of the WHO fungal priority pathogens list and the concern about the critical group. We know all these groups, they've been mentioned, but I think the key is that WHO flags up antifungal resistance as a top priority, and that we have to be aware of the epidemiology potentially changing because of climate change. So One Health have to use this opportunity to mention One Health with antibiotic resistance is often linked with animal husbandry, but in case of molds, it has to do with agriculture, the favorite environment for our molds, all the plants and crops that we grow. And antifungals are, in addition to all that, used obviously in human and animal health and in agriculture. But there's a lot of antifungals also used by all of us. You have your rose sprays and others in gardening, and that is every little matters and so forth. But what we are not that sort of thinking that much about, because we are not personally adding it, we can't see anybody spraying it and putting it in, is how antifungals are incorporated into building materials, furniture, fabrics. There's no way that your whatever jogging shoes would make it from China to here in a container ship, in a ship, without getting moldy unless they were impregnated with anti-mold agents. And similarly, all furniture that you buy during storage, fabrics, they all have some sort of anti-mold agents, which is the hidden part of all this. And what the impact of all of that is another question. And climate change driving all this, changing the having impact on new species, potentially favoring it, and what the consequences of all of the changes happening is. They can be on human health, but equally for food security, and we can have big famine issues if we don't do it right and use antifungals in agriculture responsibly. And you can't talk about fungi without talking about biofilms. All fungi want to be mushrooms, they want to be something bigger. So molds, yeasts, given half a chance, they form a biofilm. So biofilm is a life form between unicellular and multicellular organisms, and the cells are sharing work within that and behave very differently in every possible way. And so the fungi not only form biofilms in human body as an issue for line infections and foreign body infections in medicine, but they also form biofilms in water systems and hospital environments, which is something to consider. And biofilms are innately resistant to disinfectants and antimicrobials and host immune mechanisms. We all know this, but just important to note that that applies to your water lines and similars. So biofilms in water delivery systems, obviously water is not tap water is not sterile, and the design of most plumbing systems, including hospital ones, allows biofilms to form. And we all see this. You have your shower head, and if you don't clean it regularly, properly with bleach and brush, you start seeing black growth around the holes of the water opening and in your shower. The presence of pathogenic fungi like Aspergillus and Fusarium, penicillium for allergies, and Scedosporium it will lead to biofilms in the water lines, and that's just how it works. And they are in healthcare sort of setting, they are linked with healthcare acquired infections. There is papers and outbreak publications on that. But the other thing is that mold spores are released from the contaminated water lines, shower heads as bioaerosols. So that is what we also inhale. And it is important for everybody to remember to occasionally take the shower head at home off and properly disinfect and brush it, um, and even consider changing every couple of years. So we started from what do they thrive on, what then the question is what can we do? I already said the easy thing to remove is moisture. So any of them could go and that's it. Practically what we do is we advise always ventilation. It is in the summer, it's easy to say that open the windows, but it is critically important summer and winter to open the windows. And in the US, they use this term of burping the building, basically opening windows on two sides, if possible, on two sides of the flat or the house, so that there's a draft through the house for 15 minutes every couple of hours. That why not a little bit open window all the time in the winter? Well, the cold air coming in all the time will cool down the structures around the building, and that those cold structures will start to condensate moisture again and cause damp and cause issues late on long term. So instead of this sort of constant window open in one room, it's far more important to have a proper draft through the house every now and then, or particularly when you're cooking and causing steam after showers and such. Yes, as said, we can't affect warmth much. That is not quality of life. And on the other hand, warm air absorbs more moisture, and it's therefore sort of actually safer. So there's less free moisture for molds to grow on or to condensate on structures. Nutrients, yeah, clean, keep house tidy, vacuum clean your carpets, get rid of any visible mold, and so forth. It's quite depressing when we do sampling in hospitals and areas, and people try to do cleaning, and then you go and you do your wipe on the top of a shelf or something on a door frame, and you get this big lump of dust on your finger. So it's people obviously try their best and with every good intention, but it's understanding how more dust settles, and that we're really chasing dust when we are doing mold cleaning. The other thing is important to remember, and that links now, I have a case here to go through with you with the sampling. So how is the sampling by guidelines done? So you need an impactor air sampler. So it's basically a sampler that sucks in a cubic meter of air. The one we use is this SAS Duo, which uses 5 minutes to do that 1 cubic meter of air. And why do we do this? Why don't we use settle plates? Infection prevention and control teams use settle plates for other things. So why isn't that good enough? So the problem with most mold spores, and particularly Aspergillus species, they are very small spores, and that because they are so small, they can get deep into our lungs as well and cause disease compared to some other molds. So the very small spores, which also are electrostatic, in indoor environment where we have fluorescent lights and electricity in the room, you have your computers and all that electrostatic environment, the mold spores practically never settle in indoor air. They just go back up in the air, back up in the air, sort of like albatrosses, only settle down for breeding. So your settle plates give you sort of false negative results. and you have to actively suck that room air in onto a plate. So that plate is placed under that sort of perforated head, and then all the air goes around it and hits that plate. There's in the middle of this picture, so one cubic meter equals to, so we every day inhale about 40 cubic meters of air, so that so whatever is on that plate is what we get generally 40 times a day into our lungs. And that's fine. If you're immunocompetent, you cough it up. Now, the picture here is a standard sort of outdoor air sample we see maybe in the winter or so. In the summer, the counts double easily. More vegetation outside, somebody cuts the lawn. There's more molds obviously in the air at the time. But what is typical for outdoor air, what you can see there is that there are different kinds of colonies. They're not all the same. There's maybe 4 similars and then a couple of other similars. And then it's a sort of spectrum of things, because in outdoor air, you have all sorts of molds causing problems. So we look at the diversity of the molds and the amount of the molds. So this case is an NHS office. I'm not giving you any more detail than that, and looks okay, quite typical. But this is what was found behind a wardrobe, sorry, a bookshelf, and yes, the staff were complaining about respiratory symptoms, and the wall had been repainted and repainted many times before we were asked to go and sample the air and the situation. There was we measure surface moisture, there was high moisture level on the surface. So it was not surprising that it was full of molds. So this is very, very, very different from that outdoor air sample that I showed in the beginning of this case, which is here. So this is just full of mold. That is a cloud of mold where people were working. And surface sample from that, so patting that plate onto the mold growth there, you get absolute cover of fluff there. Similar other corners of that office samples look like this, and then surface sample next to it. So the summary that we provide our report here as part of the following the sample is the basically said that it was unsafe environment for anyone to work in or be in, and we evacuated the office, found people better place to work in, and then told them to fix the leaking roof and gutter, which was the main problem outside, leading to moisture inside. Because of the we couldn't identify the fungus actually by conventional methods or multi and whatever we normally use. We also sequenced it, because we do sequencing anyway quite a lot in our lab, and got the name of Aspergillus callidustus for that mold species. That alerted us to the fact that callidustus is known for being quite resistant, and we did susceptibility testing also for that, just in case somebody develops symptoms and requiring treatments. And you can see, if you can see anything on the screen, it's sorry, it's a bit small, but it's flatly resistant to all human antifungals, maybe some efficacy still left in amphotericin B. So not ideal at all. So they fixed some piping on the outside one wall there, and they repaired the wall. But they forgot the other wall, which is typical, of course, in NHS. And we always ask them to keep the windows closed before we go, just so that we measure indoor air, not outdoor air. We do the outdoor sampling separately as a comparator. And yeah, it looked better, but if you look at the sampling results, much better, fewer colonies here. But there was fumigators now, which is interesting. But then the builders said that they had kept the windows open when they were doing the repairs, and actually the windows hadn't been closed for that time, and spring was there, so outdoor Aspergillus growth was explaining all this. But there was still those little colonies pointed as Calidustus, quite a lot of it around there, so not all gone. And we told them to, these are surface samples still from those areas, dust from desks. Of course, they hadn't cleaned the place yet, so the dust still had a lot of molds in there. Another couple of months later, they were drying the area and finally fixed that other wall. And then what we came to was again, this is now maybe difficult for people who haven't get used to looking at culture plates, but basically some molds grow faster than others, so we shouldn't be looking at the amount of green on the plate, you should be counting colonies. So penicillium species grow far more quickly, and they look like it's plate full of it, but it's actually very few colonies here. And penicillium is not something we are worried about. It's a friendly environmental mold. And yeah, carried on, and finally they did a deep clean, and the air started to look like outdoor air. We also investigated why and how did we end up with Calidustus there in the office, and the estates people said that, oh, they routinely use an anti-mold paint when they go and fix these, and we looked into the contents of the paint, and it's obvious that's going to select out resistant species because they haven't fixed the problem of the moisture. So the take-home message is that really remember that it's a spectrum of diseases they cause, and the direct impact that we know that the health impacts can be divided between allergic asthma and invasive disease, or just transient colonization, depending on your immune system. And molds, of course, to cause invasive disease must grow in human body temperatures, and wider spectrum of molds can cause allergic diseases. The built environment can be an important source of exposure. It's not the preferred environment for molds to grow on, but if we really give them enough dust and building materials that favor their growth, and moisture and warmth, they will find their way. But the key is that the exposure should be controlled and reduced by restricting the growth of the three growth requirements: moisture, nutrients, and warmth, and not by using anti-mold agents that will only lead to resistant species dominating and potential further risks. So with those points, I'm happy to take questions.
Irina, thank you very much for that. That was extremely informative. We have a few questions that have come in. Seema Anwar has really given a couple of interesting points about carpets. First of all, carpet cleaning that frequently leaves a damp carpet, is that potentially an issue in itself? And secondly, if you have a room that has a mold problem, is actually washing the carpets going to make the situation worse?
So, okay, so first part of the carpet cleaning always has to be very, very thorough vacuum cleaning. So you have to remove the dust first and remove anything organic from that carpet. And it needs a whatever mat beater, whatever it takes, but proper vacuum cleaning. And then you have already reduced the amount of, but the idea that you'd have a carpet washer with sort of flooding it with water, but actually leaving a lot of the organic matter still there, yes, that's going to make things worse. Um, and but then carpet drying, making sure it dries. Ideally, you have a dehumidifier running for that period, or windows open so that the humidity has somewhere to go, and you definitely make sure that it dries up um, uh, properly. That's about the carpet cleaning. The other question was, sorry, about
If there's already a mold problem,
mm,
is it wise to sort of clean the carpets?
yeah.
Will
So
that
we
moisture make it things worse? Yeah.
Yeah, so what we advised in this office actually was to replace the carpet because the you know the carpet has seen a lot, and it's really difficult to get rid of all that mold from that carpet. Even though it wasn't growing on the carpet, it was but landing on it. It was very contaminated. The surface samples were very full of growth. Uh, the other thing we advise now our estates that stop putting carpets in where they are not really needed. You
Yeah.
know, any other hard surface is so much easier to damp clean and get rid of the dust. Carpets are really shouldn't be there. Uh, the other thing, if you there is already mold, you say the key is always to get rid of the mold first. That is the only when you solve the problem, why is the mold there? What is causing it? Then you move on to cleaning and fixing the surfaces.
Okay. And Rachel Newby, who's from Infection Control and ELHT, Rachel's asked, to what degree might surrounding areas be affected if spores are visually widespread in a particular room? Have we potentially got a whole building safety issue there? I mean, how should we check?
Yeah, so that is exactly what, yeah, I didn't have time to really to go into the details how we do things. So we work together with the estates people and surveyors. So it's not, I'm at the end of the day, I'm a um, microbiology infection doctor. It's
Mm,
not it's not my job to be an expert of buildings and what the cause of damp is. So but definitely to as part of it we always go to the neighboring spaces, so we always have the affected area, and then the or in after ventilation service in theaters where there's potentially dust and stuff from the ventilation system in the room, so the rooms are cleaned, everything is cleaned, we just do a sampling for zero counts. We always have anterooms and the corridors similarly sampled, and we can see the gradient and how the positive pressure
yeah.
pushes stuff out. So yeah, you have to work with other people and do sort of gradient and other sampling.
Yeah, and Haley Jeffries from Valinda Infection Control. Given the aging NHS estate, what guidance can teams quote to support escalation of action due to mold issues? Is there a
Yes,
national guidance they can draw upon?
yeah. So that is tricky at the moment. The Hospital Infections Healthcare Infection Society has had a working group for this now for a year and a half, and there was a bit of a pause in the work, but we are getting back together now and basically restarting. Um, and there will be a guideline. There will be a guideline, but at the moment, uh, the only things we can say is that there are areas that are zero count areas. So there are like theaters and similars, they are zero count areas, or any HEPA filtered area should be zero count area. Um, but then there are other areas, and the other spectrum of this is offices where healthy healthcare workers work. And the guidance for that, what we use, is the same as it is for homes. And now with the Arwood's case and the Arwood's law that came with the young boy dying in a mouldy home here in Manchester, following that law is quite clear that says that no visible mold basically That
Yeah.
is the sort of cutoff. But those are the two things that are sort of that is really the only legal document at the moment.
And Leander Pierre has asked for clarification. How often should windows be open to prevent mold from forming indoors? Now, I assume this relates to housing
Yeah,
rather than air-conditioned
yes.
buildings. And I
It
suppose, does the weather affect that, for instance, whether you
yeah,
should open windows?
so it depends so it applies to any space that doesn't have ventilation. So if it's your office in an NHS building which doesn't have it depends on natural ventilation, then I would open every couple of hours for 15 minutes, as the American guidance says. Um, the In houses, it depends also what you do. Nobody opens windows for a couple of minutes every couple of hours in the middle of the night. But when you're cooking, when you're showering, then have that draft two windows, two ends of the building open and get air moving.
Okay. Well, I think that brings us to the end. So I'd
I
like
can
to
see that
thank you very
Gemma,
much.
there is a question from my Gemma. You have a couple of
Ah,
really good questions. I'm happy to answer. Drop me an email, or anybody else, if I didn't cover, feel free to drop me an email. Happy to help you with questions.
okay. Well, thank you very much, Rena. That's been really insightful, greatly appreciated. Thank you to everybody for attending. The slides and stuff will be available to download very shortly. And you can also look at the webinar again on demand. So thank you all very much.
Cheers. Bye.
Thank
Bye
you.
bye.
Bye.